And of course, we want to thank Cronky Sports. And here with us is Brian Glazier of Cronky Sports. Brian, to you and the Cronky family, thank you very much for opening up this site for us. Before we bring up Murphy to provide a little more detail on what folks can expect for this from this community testing site, I'm going to turn it over to our governor to say a few words. Let's welcome Governor Jared Polis.
Well, great job, Denver, getting this testing site open. There's 34 free community testing sites all over the state of Colorado. That's in addition to hospitals and other providers. What the people of Colorado should know is that it's quick, easy, and free. Quick, easy, and free. So forget about those early days where you saw several hour waits in line. You'll be in and out 15, 20 minutes at this testing site and others. If you have symptoms, a cough, a fever, we want you to be tested. And then there's some testing for certain folks that are asymptomatic as well. But generally speaking, if you're ill, get tested. You owe it to yourself and especially those around you to know whether you have a cold or whether you have COVID-19 so that we can take the steps to make sure to protect the lives of those who are closest to you. We're so proud to partner with Denver and dozens of communities across the state to be able to offer quick, easy, free testing sites. We're coming on Memorial Day weekend. This is a time when Coloradans like to be outside, and frankly, we like to be with our friends and extended family. We're still at the point where we really hope that as many Coloradans as possible enjoy this Memorial Day in groups of 10 or less. Let me tell you why and kind of where we are. Right now, and I talked to our state epidemiologist this morning, about 1 in 300 Coloradans are contagious with coronavirus right now. So just imagine that people didn't heed the advice to stay in groups of 10 or less. Imagine there were 50, 100 groups of 50 people, 100 people across the state. If you're in a group of 100 people, there's a 1 in 3 chance that somebody there has coronavirus. And that one case in a group of 100 people quickly becomes 20 or 30 cases. That's how contagious it is. Each one of those can become several more cases. That would mean that we would move backward, our hospitals would fill up again, and communities that were directly affected would have to take additional steps to keep people safe. So let's be smart. Coloradans are smart. If you're out in a group of 8, 9 people, if somebody has it, it might only be 3 people that get it instead of 30 people. And you also only have, if you're in a group of 10, about a 1 in 30 chance of being around somebody with coronavirus instead of a 1 in 3 chance. Or in a group of 200 or 300, it might almost be a certainty or a likelihood that at least one person is contagious with coronavirus. About half the people who are contagious with coronavirus don't have symptoms, don't know they have it. They're not deliberately affecting others. We have thousands of coronavirus Marys among us, people that unwittingly can spread the virus to people for whom it might be fatal or required extended hospitalizations without themselves being ill. It's still a mystery to scientists what factors in our own unique biology lead to such different clinical manifestations of coronavirus, ranging from completely asymptomatic to deadly pneumonia or organ failure. Scientists are learning more every day. And in the meantime, let's all have a safe Memorial Day weekend. Let's honor the holiday, of course, for what it is, honoring those who gave their lives in our nation's service. And in doing that, let's not put our own lives at risk and the lives of our fellow Coloradans at risk. And try to do that if you're having a barbecue, if you're going to an area in groups of 10 or less, to make sure that you have the very best chance to avoid the virus yourself and to avoid Colorado reversing the successful course that we've been on. I'm also very excited today to formally announce something that we've talked about at the 20,000 foot level in the past, and that is the exact parameters of our partnership from the state of Colorado with Colorado State University to test asymptomatic workers and residents at nursing facilities. We've now formalized that agreement. For 8 weeks, we're testing it up to 30 of our nursing facilities. And we know that we can prevent infection by testing people who go in and work in those nursing facilities, residents. We can help keep it out of areas that have extremely high hospitalization and death rates. And we're with CSU in that regard. This is easy to get tested. We've now reached a point, by the way, through lots of hard work, the mayor's work, our state team's work, the Emergency Operations Center, the National Guard, partnering with international private providers as well as the administration to have enough tests and enough testing capacity for it to be free, easy, and quick. Those are the three best things that you could want. Free, you don't have to pay for it. Easy, guess what? They don't even stick it all the way up your head. You actually rub a Q-tip-like thing around your nose yourself. Not at all painful, incredibly easy. Quick, you should be in and out of here in 15 minutes, 20 minutes. I mean, maybe there's some time of day where it's 30, 40 minutes, but you should be out of here, and probably sometimes where it's 5, 10 minutes. So it's easy, it's quick. 34 sites across the state. This one opens 7 days a week. It starts tomorrow. And if you're symptomatic, please get tested. Thank you to the City of Denver. Thank you to the mayor. Thank you to all of our community health partners across the entire state for helping to make testing a reality, to make sure that we can truly isolate, quarantine, and contain this deadly virus, to prevent the kind of devastating closures that occurred in our state last month. Thank you again, and we'll turn it over to the mayor.
Thank you, Governor Polis, and again, thank you for your leadership of the state. You are the right leader at the right time for Colorado. With that, I want to bring up Murphy Robinson, our Director of Safety, who has, again, led this effort to get this process, this testing site, over the finish line. Murphy?
Thank you, Mayor. Hello, everyone. I'm Murphy Robinson, Executive Director for the Department of Public Safety and the leader of the testing task force who put this site together in record time. I'd like to take a moment to acknowledge the hard work of the 63-plus members of the Denver Testing Task Force and the City Attorney's Office, made up of staff across the city, our partners in Denver Health, as well as private industry. An extra special thank you to Bruce Glazer with Congregate Sports for allowing us to use this space. Thank you so much, Bruce. Renee Ortiz with Eventful Pro, who is our event planner. LabCorp for being our partnering lab, Dr. Greg LaBerge of our Denver Crime Lab, Dr. David Cameron, Dr. Sarah Rowan, and Dr. Judy Schley, who have been my medical advisors through this time and serve as my medical advisory team, and that have played a key role in getting this equipped and operational in just 10 days. I also want to acknowledge some of the Metro County partners here. With us today, we have Ray Gonzalez from Adams County. He's our Adams County manager. Don Davis, the Jeffco County manager, as well as Chief Ron Abramson from the Colorado Rangers. Access to testing is very important as we move forward towards recovery from the pandemic. This testing site is free and open to all of our community who are experiencing symptoms of the COVID-19 virus. The test being conducted at this site will tell you if you have a COVID-19 virus in your body. There is a screening tool at the testing registration website that will help residents determine whether or not this test is appropriate for them based on their individual symptoms. We encourage anyone who wants to be tested to visit the COVID testing page on the denvergov.org website to determine if they are eligible for testing. Unlike previous test sites, testing is not limited to those who have a doctor's order or those who are part of the high-risk group. We welcome all individuals in the Denver metro area with any symptoms to visit our website and get registered to get a test. It is important to note that this specific test is not for those who think they may have had COVID in the past. Unlike previous testing methods, this test is done quickly and easily with a nasal swab test that the patient will perform themselves. There's a video on the testing website that demonstrates how this is exactly done. Testing site staff will collect the swab and send it to our testing partner, LabCorp, and the results will be available within 3 days on the LabCorp website. This location is a drive-up testing site location and will be open 7 days a week, 8 to 5, like the mayor and the governor said. There are no appointments necessary, so patients can register on the website and come down to the Pepsi Center at their own convenience. If you cannot make it to the Pepsi Center or have problems with transportation, or you are so symptomatic that you cannot leave your home, we invite you to call 311 for further assistance, and we will utilize another way of testing, mobile or another health care provider to help you get tested so that you can understand if you have coronavirus. The goal for the Denver COVID testing site is to supplement our healthcare system and mobile testing applications to broaden the testing in Denver and across the state. If you think you have symptoms of COVID-19 and are suspicious that you have the virus, please do not hesitate to register for a test. Thank you so much.
Before we open up Q&A, I want to apologize, my friend Bruce. I think I called you Brian per script. Okay, whoever wrote the script, I blame him. You at least know I was on script. Bruce Glazier over there, folks, with Cronky Sports. All right, let's open up for question and answer. The governor and Murphy have agreed to be here for question and answer as well.
Mr. Mayor, thank you very much. You have indicated that you want to conduct at least 1,000 tests a day. Is that enough? That question for you, and Governor, for you as well. You have indicated that you want to do 8,500. So if you could both of these answers, 1,000 enough? Where are we getting to 8,500 people?
Yeah, you know, that number is based off of a formula that's issued by CDC that says you want to test 150 residents per 100,000 people per day. And if you consider what our population is, we should be just over 1,000 people per day that we're testing. We have the capacity today, literally, to test up to 4,000 people in the city of Denver. And so if we deployed all the resources with all of our partners, we can get to 4,000. But we feel 1,000 here, or at least 1,000 target per day, is a comfortable number. And if we're able to do this quick testing, we can probably do more. And we have the ability to expand here to go up to 1,000 folks here if we want. Right now, we're set for 500 per day. Governor?
So, we want to make sure, and we are able to test everybody who's symptomatic in the state. Now, something that has occurred because schools are virtual, a lot of Coloradans are staying at home and limiting their contact, is all of these contagious diseases are at the non-COVID ones are at a record low. So few people have the cold or flu because the social distancing has also reduced the spread of all those symptomatic colds and flus that are out there. So that's good. People are healthier. That's great. But that also means there's less people that even have symptoms to be tested. So in a city of, 100,000 people, are there 1,000 people a day with cold flu-like symptoms? There may or may not be. But the message is, and especially as people are getting out more, they're more likely to get the regular cold or flu in addition to COVID. So please, just get tested if you're symptomatic. And if you're sick, go to their symptom tracker. There's 36 sites across the state. Denver's obviously a bigger one. 1,000 a day is a lot. Others in small rural counties might see a few dozen every day. But the key point is, no matter where you live in Colorado, we want it to be convenient for you, easy, free, quick, convenient. Well, 1,000 is, 500 or 1,000 is certainly a lot. I mean, Denver, you can just do the math. You're just about 10% of the state, Mayor, or so, roughly. So if you're doing 1,000 in Denver, that would be about 10,000 across the state, and that's pro rata. But keep in mind, this site is serving more than just Denver residents. I mean, there's several across the metro area, but this site is also partnering with Adams County and others. So absolutely, with 34 sites, this is the biggest one. This is handles the most people. In a small rural county, there might just be a couple dozen a day. So no matter where you live, easy, free, quick, convenient if you're symptomatic. And this at Pepsi Center that Mayor Hancock in Denver worked on is certainly the single biggest piece of that, because it's a convenient location for hundreds of thousands of people, if not millions, in our state. Well, testing is one of our 4 strategies to be able to combat this. People ask a lot about testing. It's available for anybody who's sick. We want you to get tested. The other three are wearing masks in public. I'm very supportive of the work of Mayor Hancock and many other mayors to make sure that folks are wearing masks when they're shopping, not just for their own safety, but the safety of those who work in retail who are already wearing masks. The additional steps to protect our most vulnerable. And that means the personal protective equipment, the high quality masks that we've sent in partnership with the federal government and others to retirement centers and nursing homes across the state, the testing of asymptomatic workers at those locations, and finally the social distancing. With 1 in 300 Coloradans who are contagious, and the vast majority of them not knowing it, it's so important that we don't congregate in groups of hundreds of people. Each one is really almost guaranteed to create another outbreak, and each of those could create additional outbreaks. So let's be careful for Memorial Day weekend. If you want to take a calculated risk and be in a group of 10, you can. If you do the math, you'll see that in a group of 10, there's probably about a 1 in 30 chance that somebody in that group is contagious with COVID. If it goes from 1 person to 3, you might have a 1 in 90, 1 in 100 chance of getting it. But if you're in a group of 100 or 200, it's more likely than not that there is somebody who's contagious with COVID in that group, and that it could easily spread to 20, 30 people from that single contagious person. And that's why we all want to honor those who we lost in Memorial Day in life, their lives in service to our nation. And if you can, stay with your immediate family group, those you live with. Good time for a family barbecue. And if you absolutely must mix with others, try to keep it in a group of 10 or less. Thank you. We have widespread free testing available. Frankly, the less people that need it because they have symptoms, the more that we can direct to asymptomatic workers at our nursing homes, senior care facilities, and retirement facilities. So if there aren't Coloradans that are symptomatic because the social distancing is working and keeping down symptoms, it will enable us to keep it out of more nursing homes. And we just announced our partnership with CSU for 30 nursing homes across the state, many of the largest. We're also doing work with the Colorado National Guard to test people with no symptoms who work in those nursing homes, and they've already screened out more than a dozen people who've tested positive without knowing it, who would have been going into senior homes. Each one of those could have led to outbreaks that cost a dozen or more lives, given the effect of this virus on those who are in their 70s and 80s.
Mayor, how much is this all costing you?
Well, first of all, let me just say how grateful I am the governor's here because he gets most of the questions. We used our first tranche of our federal CARES Act money, about $5 million to commit to this site. And we just recently, Murphy, maybe you'll come up here, committed another tranche of money from the money that's flowing through the state from CARES Act as well.
So from the CARES Act, we've dedicated about $3.5 million to this site specifically, but also realize that this is not the only effort going on across the state and across the city and county of Denver. We have the mobile Winnie and the mobile units that we have put out that are responding to folks' homes, as well as a number of other facilities, healthcare facilities, with not only Denver Health, but a lot of our hospitals that'll be seeing part of those allocations.
Director Robinson, you mentioned that this is for everybody. I want to ask a question, but it's kind of a two-layer question. How often do people get tested? And the reason I ask that is because there are a number of first responders that may or may not use this, and my question is, do they have the ability to get tested elsewhere?
Excellent question. So I probably will bring up Dr. Judy Schley to talk a little bit more in depth about this, but we are asking that folks don't come back to the site unless they've been tested for the last 7 days. But Dr. Schley, why don't you...
Good afternoon. Through Denver Health, the Occupational Health Department, city workers as well as first responders can get tested, and we have a survey that they complete where they put in their risks and their symptoms, and if they meet the qualifications, they get tested, and they go through a drive-through testing site that's located. There are 3 sites at Denver Health, and it's very quick. Within 10 minutes, they're in and out.
See.
Actually, two questions. Además de este sitio de pruebas, ¿van a abrir otros en el estado?
Sí. Aquí en el Pepsi Center tenemos pruebas para coronavirus gratis, rápido, fácil. Es muy fácil, desde 15 minutos, 20 minutos, gratis. No necesita una nota de doctor, no necesita ser ciudadano. Es gratis, rápido, fácil aquí en Pepsi Center y también 35 más sitios durante todo el estado.
La segunda es, en la clínica Stripe va a tener pruebas
Sí.
para los indocumentados y las personas que no tienen seguro, va a ser gratis.
Ya, sí. Sí, en sitios como Stride y aquí en Pepsi Center, todas las pruebas son gratis para cualquier persona quien tiene enfermedad y temperatura y síntomas de enfermedad. Es gratis, fácil, no necesita tener insurance, no necesita tener un doctor, no necesita ser un ciudadano. Es gratis, rápido y fácil aquí en Pepsi Center, en Stride Centro y muchos otros sitios durante todo el estado. Gracias. So I hadn't heard that. You just broke that news to me. They've been limiting. Are they employees or folks that are there? So we have. This virus spreads rapidly in congregate living facilities, and that can mean college dorms, nursing homes, prisons, immigration detention centers, where people are living in proximity indoors, getting their meals together. It spreads extremely rapidly. And that's why we are focusing a lot of the testing effort around asymptomatic folks that work at those facilities. We would be thrilled to partner with ICE if they need additional testing or resources, if they need help isolating those who might be contagious. But it doesn't discriminate based on the nature of the congregate facility. But wherever people live together in close proximity, share their meals together, spend a lot of time indoors together, it shows a much higher contagion factor. And that's why facilities like the ICE facility in Aurora, our prisons, our nursing homes are of such great concern.
A question for Mr. Robinson and Mr. Mayor. What's next? Will this be enough?
The question that was just asked was, will this be enough? What's next? You know, I think as everyone will understand that COVID is a constantly moving target. We are continually every hour learning more and more about this disease. And so as to what's next is to be determined. However, I will tell you we have a very strong team of doctors and professionals looking at how we can streamline the processes of making sure not only can we open up our economy again, but that we can make sure that we can curve the curve and making sure that there is no reintroduction of this virus into the city and county of Denver. This is the start. This testing site will enable us to have data to understand what is this spread all about and what does it look like in the city and county of Denver and frankly in the metro area. However, as more tests come to us from the FDA and are approved, we will be able to introduce those types of tests at this site.
What did you learn in March from the previous attempt in July when there were too many people who showed up at once? Were there lessons that you learned from that one that you took and implemented in this?
Sure, I can talk from the Denver's point of perspective, but I also would give it to the governor as well. You know, the great thing about partnership is that's exactly what it is as the state did an excellent job launching their testing site, they also shared what they learned, what we could avoid doing and what we could do as terms of their best practices. And so we talked to the state. The state has been an excellent partner in standing up this site here today. So, Governor, I didn't know if you had any more there.
Un poco más en español antes, ¿sí? ¿Dónde está? Did he go? Oh, there, okay, sí. Es importante saber si no necesita ser documentado para recibir la prueba gratis y fácil. Y nadie va a preguntar a usted si usted tiene documentaciones. Es muy importante saberlo porque todo el estado estamos juntos en esta lucha contra este virus. Okay. So let me talk about how the technology's improved. In the early days, it required somebody who was trained medically to have and had the PPE to insert the long nasal pharyngeal swab into the back of your nose. That's actually not what they're doing here. That was the only protocol that had been validated at that time. The reason this is so much quicker and easier is they basically hand you a Q-tip-like thing. You just rub it around your nose and you hand it back to somebody wearing a glove. So it cuts down on the difficulty of administering those tests, makes it significantly quicker. And when we opened Lowry, it was, I believe, one of the first drive-through testing sites in the nation, no less the state. So everybody went there. People drove an hour, 2 hours to get there. Now we have 34 free community testing sites across the state. So if you live in Fort Collins, you'll go up there. If you live in Colorado Springs, you're going to go there. If you live in Boulder, you'll go there. And there are a number of sites across the Denver metropolitan region, including at Stride and other community health clinics. So we are excited that we've made it free, easy, quick for everybody. If you have symptoms, please be tested, find out if you have COVID. We need that visibility. You deserve that visibility. And we appreciate everybody for talking about this great progress that Denver has made in partnership with the state.
So let us conclude with just underscoring, and I want to thank the governor for being here. I want to thank Murphy Robinson and the entire task force that helped make this happen. Once again, to the Kroenke family and enterprises for helping to make this happen. Bruce, thank you. To all the medical professionals and public health professionals who are here to help, that were a part of making this happen. Just to underscore this point, from day one, and the governor, I'd love to use the term back in the day, that was 4 months ago. That's how it seemed like forever, and back in the day. We've been at this now, I think we're in 65th day of our emergency operation in the city of Denver. This has gone, it seems like forever. But we've always underscored the fact and put a highlight, underline under the fact that we've got to be able to boost testing. And we've got to make testing accessible to all residents. It can't just be those who have the ability to access testing through their physician. This is for everyone. I want to be very clear to all of our residents in the metro area. We're not asking questions about citizenship here when you come through. There's nothing on the form to denote whether or not someone is a citizen or not. We don't care if you're a resident of Denver or Jefferson County or Adams County or Douglas County. This is all about the virus. It's all about boxing that virus in, and so we want folks to come and get tested. We ask you to go to denvergov.org or to call 311. If for some reason, as Director Murphy has pointed out, you cannot make it here, we do have a mobile unit that if, particularly for Denver residents, this is primarily for Denver residents, we will send the mobile unit out on a reserve basis to take a test for you and get you the results. But I don't want you to believe that in any means this is anything other than about anything other than getting people tested and making sure that we get on top of this virus and stay on this side of the epi curve so that we can begin to restore, repair, and to once again reignite our economy and the healthiness of our people. Thank you all for being here. God bless you.